Hello, OT friends, and welcome to the Uncommon OT series. My name is Patricia Modis. I'm the Transitions OT, and I'm your host. So today, I'm very excited to introduce you to our guest of honor, Lashandra Holmes-Russell. She also goes by Elle. So Elle is an uncommon occupational therapist who is board certified, practicing in the state of Virginia. She received her Master's of Science degree in Occupational Therapy from Shenandoah University and her certificate in Early Intervention from Georgetown University in 2019. She is the owner of Occupational Transitions, LLC, a mobile clinic practice providing the following services in person and virtual via Zoom: occupation-based maternal mental health, lactation, breastfeeding education and counseling, postnatal yoga classes, infant massage classes, and early childhood developmental screenings and early intention therapy. Elle is passionate about partnering with families in order to collaboratively identify therapeutic interventions that support and strengthen familial bonds and relationships in order to maximize the mental health and well-being of the mother for optimal childhood developmental outcomes. By taking a holistic approach in supporting the mother to and through the transition of motherhood and parenthood, including the up to 1 year postpartum period. For it is Elle's held belief that relationship is the organizing factor in which all developmental, physical, social, and emotional occurs, and that every family deserves an exceptionally bright beginning. A belief that continues to guide her professional development and aspirations towards becoming an international board certified lactation consultant and certified perinatal mental health through PSI. So without further ado, I'd like to present to you Elle Holmes-Russell. Welcome to the podcast, Elle.
Thank you. Thank you so much. I am so excited to be here. Thank you for the opportunity to share with your audience what it is that I do. So I hope that I leave or share some tidbit of information that is just guiding, the next generation of occupational therapists, or at least maybe give someone that stepping stone to pursue something that they're passionate about. So thank you.
Well, thanks for taking the time, because that's exactly the goal of this platform, is to inform other OTs that this type of work is available to them, is an option to them. And here you are, we're introducing you to the OT world as an OT who has gone through the steps herself, right? So you do so much work to support mothers with the services that I mentioned in your bio. So I can't wait to delve into that. But before we do, I'd love to hear a little bit more about you. Tell us a little bit about Elle, a little bit about your background.
Sure, absolutely. As I like to share with everyone, I am just a country girl from Alabama who loves, sweet tea, SEC, and God in her country. That is who I am at the core of being a person. I am an occupational therapist. I am a mother of one, have a beautiful 10-year-old son. I am a former breastfeeding mom, as well as a postpartum anxiety survivor. So a lot of my work surrounding supporting mothers and infants and families is actually birthed out of my own experience in the transition into motherhood. I was, one of those mothers who had her child, I guess, later in life. So I was in my early 30s. So that was a long time to be by myself and only have to think about myself. So I definitely understood the challenges that can come with that transitions, but through those challenges, there were activities that I found that supported my ability to manage my, emotional regulations and, my moods during that time. And so that's when I took up running and sewing and crocheting. So those are all things that I love and have incorporated into my practice in serving moms. And now I am here as an OT. So this is a second career for me. So I am excited to be in this space as an occupational therapist, and I just love all of the possibilities that come with it.
Oh, thanks so much for sharing a little bit about yourself. And I love how you've, through your challenges, you've really found the link between occupational therapy and, being able to address some of those needs that you yourself were having. So excited to hear about that. Can you describe to us a little bit about the uncommon OT work that you do, the population that you serve, and some of the needs that you may be addressing with them?
Absolutely. So I got into this work actually as a student. So, as students, we have to do sort of like a psychosocial rotation.
Yes.
And one of mine was in a community-based clinic. And it was led by my mental health professor, Dr. Susan Crudis, who will always be my champion in terms of my commitment into working in the mental health space in some capacity. But my interest initially was working in pediatrics and early intervention. And so as I began to learn more about early intervention and understanding that it uses that coaching model, so as
Mm-hmm.
a therapist, we're less hands-on, and it is the parents who's actually doing the therapeutic interventions once we model it or we discuss it with them and talk them through it. And it was through this experience that I was like, and you're seeing that most often the primary caregiver is going to be the mother.
Mm-hmm.
And I was like, in order for that therapeutic process to be successful, like I have to make sure that my mom is well. And again, knowing the challenges that comes with transitioning to motherhood, it just got me to thinking about like, why aren't we assessing this, in
Mm-hmm.
occupational therapy practice? Um, and I was like, this is just a great link, maternal mental health and also early intervention. So as a student, I just started thinking about like, what can I do? What programs can I develop as I became board certified. So actually my work started out as creating a psychosocial support group for moms, because that's one
Fantastic.
of the things that moms talk about in that transition is that social isolation piece, right? So before you have a baby, most often, if this is your first time, like you have all of this free time to go out and hang out with friends. And then once you transition into that motherhood role, we have less free time. We seem to maybe even not have as much contact with the friends because now our life experiences are different,
Mm-hmm.
so I'm not available when they're available and vice versa. And so considering that I love to sew, I was like, I'm going to create this psychosocial support group around sewing. It is something that I love to do
Mm-hmm.
anyway. It was just easy for me to do it. So that is where I started out first. My plan was to launch that in 2020 in person, and then COVID happened.
Yes.
But I was so passionate about the work that I was like, we're going to offer this virtually. So I
Mm-hmm.
actually offered the service for free because I wanted to beta test it. And
Yes.
so I had 3 moms to sign up. And the 3 moms all just gave positive feedback about the experience. So even though we weren't able to meet in person, they still was able to make that psychosocial connection. And
Mm-hmm.
I was also able to introduce some topics as it surrounds that transition to motherhood. And one of them that I'm really passionate about is maternal emotional regulation.
Mm-hmm.
So through the occupation of sewing, we're able to practice that emotional regulation, especially for those where this is something new that they're
Yes.
exploring. And so your project may not come out the way that you intended to. You may not have cut the fabric the way that you have intended to. So that was a way for us to practice this skill in the non-threatening way.
I love that so much. Is
But
this
to also,
only open for moms?
yes, it
I
is
feel
only
that we can all benefit from a little bit of this. Sorry, I had to interject,
it's
but
okay.
amazing.
Um, but it's also an opportunity for me to now extrapolate that from the sewing context and be like, you know what? The feeling is the same
Mm-hmm.
whenever there's a trigger that as we say, impacts that safety zone of ours, we're going to get that same internal feeling. We just have to recognize what the trigger is in our environment. And so I was able
Yes.
to tell the moms, when this feeling transitions into that mother role, the same thing you did here doing sewing, we took a step back, we took a breather, we reassessed, We looked at, is my response, matches the size of the problem.
Yes.
And if it doesn't, what can I do? How can I give a more adaptive response? And so it was just a great way to just kind of introduce that skill. And then for the moms to have that, in their mind. So when they went back home and there was something triggering within that home environment as it relates to our transition to motherhood, they now had something they can reflect back on. And it was just always great to just hear updates in our next meeting. So
Wow, incredible. I have so many questions because you said so many amazing things. First, you bridging your skill set, right? You love to sew, you're an OT, putting it all together, and here you are. I believe that when clinicians do that, it's a win-win. Like it's very difficult for it to not work just because the formula is there. Adapting your plan, right? COVID happened. What were you going to do? Just sit around? You adapted yourself just like a true OT, adapted your plan to still meet the needs of your clients. And again, from another angle of this is like the entrepreneur angle, right? Where you had the opportunity to beta test your idea and really learned a lot through that process. So you choose which of those do you want to expand on a little bit more?
I want to say the adaptation, because that really gave me the confidence to like go and pursue other avenues as it relates to supporting moms in this space. So, like I mentioned, it started out with just that psychosocial support group, right? Because we're always thinking about where do we fit in certain spaces where we're not considered a traditional member of that healthcare team. And so facilitating groups is definitely within the scope of our practice. So that's why I felt confident in starting with that. And then it just transitioned into lactation and breastfeeding support.
Yes. And I completely agree with the idea of us being the most effective group facilitators. In my own personal experiences, professional experiences where OT was not very visible, that was always my go-to. We're trained in group dynamics. We know what we're talking about. We were trained in this quite well.
Yes.
And it becomes evident after we start creating our plan. So I'm so glad that you highlighted that so that our listeners can really also, tap into that skill, right? Because there's a whole nother set of skills involved with that. So thank you again for sharing, all of that wonderful information. Can you describe to us a little bit your path and what brought you here? I know you talked about your own personal challenges and going through this. What about your path after that, now that you've found your calling and you've created, you've sort of built your idea from the ground up?
Yes. Honestly, it was not a linear path. So a lot of people ask me, I was
zigzag.
Like, no. It started with the one idea, the psychosocial support group. And then, like I said, it just grew into wanting to do lactation and breastfeeding support. And again, that grew out of my experience of working in a pediatric outpatient clinic. And we get referrals for feeding. And again, my own personal experience. And again, looking at where does OT fit within the scope of lactation and breastfeeding support, especially for those who may not want to be a breastfeeding support specialist where we provide care management services. So just from the OT perspective, one of the things that comes to mind is positioning. That's within the scope of our practice, right? Looking at oral motor for the infants that come in. So we can assess a latch, like is the baby's mouth, when it's open, it should have a certain angle. The lip should be positioned in a certain way. There should be undulation that we can see in jaw movements that we can listen to when the baby is taking in the milk. So there are some things that still fit within the scope of our practice as OTs, even if we're not providing breastfeeding care management, to where we can say, we've accessed the biomechanics of breastfeeding. I think you need to go and see an international board certified lactation consultant. So that's one of the things, small group of us are trying to do, advocate for just basic lactation and breastfeeding support embedded in our education.
Mm-hmm.
Because I feel like anyone, whether it's OTs, whether it's PTs, whether it's pediatrician, whether it's primary care physicians, anyone who is caring for infant, women's, and families need to have basic knowledge surrounding this practice, because for us as OTs, it's also a valued occupation.
Yes, it
right?
is.
And so just having that basic knowledge and knowing where to refer. So that's where it got my interest. So again, these are all things that just gradually came up. And as I started exploring that, it went to, you know what? Moms with spinal cord injury. That's a
Oh.
special population, especially when we look at the level of injury. If it's,
Mm-hmm.
T6 and higher, that is going to impact that breastfeeding process.
Yes.
And so that's where I am right now in that. And I most recently have expanded providing my support services to women who are in the criminal justice system. And that came
Yes.
from networking at the student level. So I tell students, go to conferences. Don't just network with other students. Find clinicians who are practicing in the area that you're interested in and
Mm-hmm.
network with them, because that's how my connection came with the justice system. It was a colleague that 20 years within the mental health. She is a qualified mental health professional, and she got a referral. Client, decreased participation in self-care. The client came to her. This client was an expectant mom. And my colleague was like, I got mental health experience, but not working with this population, but I have a
Yes.
colleague. And she reached out to me. And again, that was a population I had not considered when I was creating my programs. But once I got to working with this, I was like, there's a need that can
Wow.
be integration support. So my path was not, I guess it was linear because everything just kind of fell into place. Let me put it like
Yes.
that. But it all just, I don't know, I was just open to whatever possibilities. And it just started out with one thing. So one
Yes.
thing can expand into, so many things. As long as you're connected to the right people, talk about it. Even if you feel like you're out there by yourself, there are other OTs who are doing the work, and your tribe will find you.
Yes. I Again, I agree with everything that you said. And, this whole idea of networking, I even say network with OTs who may know OTs who are
Yes,
working in that
absolutely.
area, because you just don't know who knows anybody.
Yes.
But follow your instincts, because if that's where your interest lies, it'll
Mhm.
all fall into place, right?
Yes.
And in your case, it seems also that once your own personal mission was clear, then everything fell into place. It was as
Yes.
if you were attracting
Yes, absolutely.
everyone who had this particular need from all sorts of settings.
Yes. Yes.
So amazing. I'd like to spend a couple of minutes about talking a little bit more about the program that you just mentioned, because I know you and I talked about that
Yes.
off the air. So would you mind sharing a little bit about that? Because I think that's such inspiring work, and I'd love for our listeners to hear a little bit more too.
Sure. The criminal justice
Yes.
program. Yes. So just looking at supports within the prison systems, within the justice systems for women who are incarcerated, there really is a lack of support. And because it is not mandated that prison systems actually have healthcare, although systems do, it's just not mandated.
Mm-hmm.
There's really no checks and balances. So the level of care is going to vary, state to state, even within a state.
Yeah.
It could vary. And so we have our moms, and most women who are in there, they're in there for nonviolent crime. So it's most likely going to be for drugs, property, damage. So just really nonviolent crimes, or drug abuse or drug use.
Mm-hmm.
And so as I started doing this work, the one thing that I first and foremost want people to understand is, regardless of these individuals' background, they are still humans. And I
Mm-hmm.
feel like at the core, once you become pregnant, that evens the playing field for all of us, no matter our socioeconomic status or our backgrounds. And these women need to be provided with opportunities and services that's going to support not only their health, but their successful transition into motherhood.
Yes.
And so as I was doing my needs assessments and looking at what supports need to be in place to reduce recidivism for these individuals, a lot of it boils down to education, right? Because we already know that some of the decisions that were made because one, we came up against some challenges and we didn't know how to handle those challenges.
Yeah.
And so we engaged in activities that were illegal, right? It impacted our ability to make judgments about relationships. So sometimes women are in abusive relationships. It may have led to homelessness. So a lot of the skills that the mother needed was really based around education.
Yes.
So because they have this history, my program is really an education-based skill program, right? It's a 6 to 8 week program that covers various topics from building your social support network system, but looking beyond just your family and friends, right? Because as occupational therapists, we go from the micro to the macro level, from what does your neighborhood provide? Is there a sidewalk where you can get out there and walk safely? What about the library? What about the gym? What services are available? So helping mothers to expand what that looks like, because let's be honest, not all of us have friends and family that we can rely on, right?
Yes.
There's other resources within the communities that is available. So we work with moms. So as they're preparing for community reintegration, they already know what services are available and we got those in place.
That's great.
We also look at maternal emotional regulation. Again, because that is so important when it comes to our mental health. So when we talk about mental health, the first thing I tell our moms is, guess what? Mental health is just our state of well-being at the moment, and that fluctuates throughout the day.
Yes.
And mental health is on a continuum from health to illness, right? And so what we're working on is not getting to the illness part. And so again, we look at what does that look like, that emotional regulation. And it is okay to be dysregulated, and I want you to know. And one of the most successful tools that has helped me in that area is the zones of regulations.
Yes.
Developed by one of our own, an OT. And it was so successful in my pediatric practice. I was like, this would be so great in working with the maternal population, because it allows us to discuss our emotions in a way, again, that is non-threatening.
Yes.
It allows us to be vulnerable, because I don't have to call my emotion what it is. I can give it a color. And then when I'm ready, I can talk about it.
Yes.
And so my moms love that idea. I was like, because as moms, we're supposed to be celebrating, right, motherhood, right? We're not upset about it and mad and anxious about it. But the truth of the reality is that motherhood is ugly sometimes. It is stressful sometimes, and I don't always enjoy it.
Yes. And on top of the biological hormonal things that are going on, which contribute to those two.
Absolutely. So we go through 6 to 8 weeks, including creating your birthing plan. Most of my moms in prisons have choices made for them. And we create a birthing plan. How do you want to give birth? Who do you want to be in the birthing room? Do you want music? Do you want, aromatherapy? So it empowers them with one of the most, I think, critical experiences that they'll ever have in their life. And we also, most importantly, talk about a postpartum plan. That's self-care. Because as moms, we forget about that. And I want to make sure, again, knowing what their history is, I want to make sure that they're giving themselves that self-love, that self-care. So when they into motherhood and they have those stressors, like they have things in their toolbox, we talk about breastfeeding for those who choose breastfeeding, because again, I want them to know, with breastfeeding, that's an 8 to 12 times a day. So as OTs, we got to start talking about daily routines, right? Setting
scheduling
up and things like that. So we go through 6 to 8 weeks. It is one-on-one, no group sessions with that, but it is a one-on-one. Even though they complete the 6 to 8 weeks, I still follow them in the postpartum period, up to 6 months minimally, but I will go up to the 1 year postpartum period. And within that, I also do developmental screenings of their little ones. And because we're working on bonding and attachment, I use the ages and stages, because that ages
Okay.
and stages is really for parents
It's
to kind of
relatable.
look at their child and
Mhm.
see if they're making these skills. So it gets the parents in tuned. And that is, again, that's what we need for that bonding, attachment, and optimal development within the dyadic relationship. Like I said, not just for the baby, but the mom is
Also
also
the mom.
developing as well. So it's
Oh,
not
Elle,
simple.
I just so love your holistic perspective on it
Thank
all.
you.
You
Thank
know,
you.
you're creating space, you're providing choices,
Mm,
you're empowering women in a setting where they are probably least empowered,
yes.
right? They have the least amount of control
Yes.
in prison. So I so very much appreciate your work. I'm
Yeah, thank
sure they very much value your work and just the type of kindness and thoughtfulness that you're putting into their experience,
you.
right?
Yeah.
A birthing plan, a postpartum plan. It also sounds like you're following them along through the different stages
Yes.
of their experience, which I think is also the most supportive thing that you
Yes.
can do.
Yeah.
It's that lack of support, I think, that's really key when it comes to our mental health and being able to utilize those supports and have access to those supports and feel safe in
Absolutely.
accessing those supports, right? So there's so many
Absolutely.
angles to all of it. So thank you for the work that you're
Thank
doing.
you. Thank you.
That was your 6 to 8 week program
Yes.
amongst the 500 other things that you're doing. um, can you try to describe to us what a typical day might be like for you? And you pick, because I know you wear a few different hats. Maybe a typical day, maybe a typical session. I know you described a little bit about the workshop,
Sure.
but maybe a typical session in another setting.
Absolutely, absolutely. So with the sewing, the psychosocial support group, that is something that is more of a 6 week, and that is just the group. We don't get into any of the breastfeeding. Like I said, we touch on like emotional regulation stuff, but it really isn't like a curriculum skill building type thing like my serving up motherhood program is.
Mhm.
So when they come in for the sewing, again, it's just really creating a space for them to have social interaction with
Yes.
individuals. And as things arise, then we can address it at that point. So they're with me for 3 hours. And then,
Wow.
yeah,
That's a long time.
it is. Generally, the classes, if they were in person, they would be 2 hours.
Okay.
But because we're doing it virtually and angles look a lot different when you're on camera, um, just give that extra hour so that we're
Mhm.
not pressed for time and everybody can get their attention. But I only limit that to 4 women
Okay.
at a time.
So the project is started and completed at the same
Yes, it
within
is.
the same. Okay, got it.
Within the
That's
same.
why.
So they leave with 6 total projects.
Oh,
Absolutely.
wow, how fun.
Functional projects. Yeah. So if we go
Like
from
like
the
what?
basic, making a pillowcase,
Oh.
a tote bag, a clutch bag, a duster cardigan,
Mhm.
and a pencil skirt. Yeah.
Love it.
So those are the activities. So that's not 6. So it's like four or 5 projects, or pajama pants. Yeah, and pajama
Oh
pants.
my
So,
goodness. So that's quite a lot of that's quite a lot. And of course everyone needs a sewing machine and you
yes.
have everybody prepped for all of that. Okay.
So with the pilot program, I actually had donations. So I had people purchase the sewing machines, but because they were virtual, my ladies had their own sewing machines. But once we get back to in person, I still have the 6 machines. So my first in person group, they will be able to walk away with the sewing machine, because I don't want mothers to have developed this skill and don't have the resource to continue.
Yes, that's a
And
great point.
my hope is that, once we get the first cohort done in person, then donations will continue to come in. So each time a cohort comes in, these women can leave with the aids, the fabric, the sewing machine that they need, because, what good is a skill if they have it only in that environment, then they go back home and they don't have access to it.
Yes. And I
So
imagine you also get better over time with practice,
yes,
etc.
absolutely. And we continue to meet. So I
Yeah.
might host a, sewing session. Ladies, come on. And we don't have to sew the same project. But again, it's just making sure we have that continued connection with one another. Just because the 6 weeks is over with, doesn't mean we're done. They can form their own relationships and keep in contact with each other as well.
Mhm.
So,
Can you
um,
describe to us the structure of this group?
mhm. Yeah. So this group is, I call them well moms. These are just moms who have transitioned. And it does not have to be first time moms, because we know that every birth experience is different. So
Hmm.
mom may not have had any significant changes in mood with the first child, but the second one might have really taken her down through there.
Yes.
So it really is open to all new moms, like I said, moms who are in the up to 1 year postpartum period, while we need support, all throughout motherhood. Like, I'm 10 years in this and I still need a support system. That
Hmm.
first year is just really, really critical. So that's why I really focus on moms who are within the up to 1 year postpartum period. And they don't have to be moms who have a clinical diagnosis, because our research shows that, you don't have to meet the clinical diagnosis for you to realize or feel the impact that a change in mood has, right?
Yes.
So any mother who is just struggling, with that group is open to them.
Yes.
It can be self-referral, or it can be referral from a friend, a family member, another community-based provider. And again, the beta test was free, um, and I offer it on a sliding scale. So
Okay.
there is a fee associated with it, but there's also a sliding scale that is based on income,
Okay.
for the sewing group. The 6 to 8 week group, of course, that's within the prison system. So that's sort of like where my passion lies. So that one is also offered pro bono,
Okay.
because, like I said, right now I want these moms to be able to come out, integrate into the community, and like just really just take over that motherhood role without finances being an issue and a concern for them.
Yes.
So
And
this is
also
timing.
having the skills to be
Yes.
able to perform that role
Mhm.
in the best way that they can, right?
Absolutely. Absolutely. So that one, but that one is through Real Life. That is a community-based housing, supporting those who are preparing for community reintegration. They stay there for 6 months, and then they graduate from the program. And so I get them out wherever they are in their journey. They could
Hmm.
be in the antepartum, still pregnant, or they may be in the program after they've had the baby. So just long as they're within that up to 1 year postpartum period,
Okay.
I see them. The referral generally comes from the social worker. So when I get the referral, I contact them. And everything has been done over Zoom so far. And
Hmm.
so because this is all education based, but even though it's education, it's still occupation based, right? So I have
Yes.
them doing something. So even when we're doing the social support system, like I use an assessment tool called the Eco Map, one of my favorite tools to use. And this is actually birthed out of the social work profession. But what we do is it's a picture of what those support systems look like, and not only identifies them, but the frequency of it and the strength of
Hmm.
those relationships. So you can use it as an assessment tool, pre and post
Yes.
outcomes. And that is probably one of the most powerful tools that a lot of moms say is like, wow, because in going through their journey, sometimes they even forget the supports that they do have. And then
Hmm.
by seeing that picture, they're like, wow, I have a lot of supports. I didn't always feel like I did, but I do. So yeah, so get the
I
referral.
love that alternative
Mhm.
to a list per se, right? It
Yes.
just has a different impact. So I
Yes, it
definitely
does.
will include that in our show notes, that
Yes,
resource.
absolutely. And yeah, so get the referral. I contact the mom, just like any other OT process, right? We build that occupational profile.
Hmm.
I get to know who it is that they are. And of course, I'm not going to be doing a lot of my assessment is not going to be biomechanics, right? Because generally, so mental health is going to be more cognitive based functioning. So
Hmm.
a lot of my assessments are centered around cognitive functioning, regulation skills,
Hmm.
self-efficacy, feeling. So a lot of questionnaires. And then we get into goals. So I have a goal bank that they choose from, and we prioritize those goals. And then we go through our sessions, and then we do our reassessments at the end. And again, I follow them once they're discharged. I still follow them because that is where I saw a needs gap when I
Hmm.
asked and I came on board. I said, well, once they graduate the program, is that case management still there for them?
Yes.
And I was told that it's not. But the expectant mom program is so small that the case manager, she is so invested in these women's lives that she still follows up with them after
Oh,
they're
I love
gone.
that.
But that is for this particular place, right? So again, I'm thinking globally, this may not happen everywhere. So that's where I really was like, this is where I can come in at. I can
Yeah.
serve as that piece, not only working with them while they're in the program, but there's someone still with them when they graduate. And I can also be that facilitator to get them linked to other services that they may need. So
Yes.
my typical day, depending on how many I have scheduled, sometimes it's one, it might be three individuals. So my sessions are an hour with them. Sometimes it goes longer because my moms don't be want to leave and hang up because, like what you see is what you get with me. And I just want them to know, like, I am a member of your tribe. I have the same shared thoughts and feelings that you have as it relates to motherhood and raising and rearing a child. Yeah, our backgrounds may be different, but again, once we became mothers, that evened the playing field for us,
Yes.
So I have developed a really good relationships with my mom. So I have to kind of tread that fine line of still maintaining that professional therapeutic relationship while also making sure that they feel supported. So my day can go anywhere from just an hour
Hmm.
practicing in the maternal mental health field, or it can go to 5 hours, just depending on how many moms are with me.
Yes. Well, it sounds like you're excellent at identifying needs, right? And then kind of problem solving and coming up with a plan on how to at least, find out more, right? Or see what can be done. And I think that that's again, the OT lens that
Yeah.
that we have, right? And I want to encourage our listeners to really lean into that, especially if you're interested in this type of work.
Mhm.
This whole networking idea is 1000% effective. As we're talking right now, I already have a person in mind that I want to link you with
Thank
who
you.
also works with incarcerated individuals, but had somehow figured out a grant type of situation. So I'd love for the two of you to link up because it's all community reintegration
Yes.
and it's OT. So, maybe you can, I don't know, inspire one another, at least find each other as support.
Yes.
Um, but this is incredible. And the programs that you've developed are incredible. You're doing such great OT work. And
Thank
I
you.
want to, just kind of stop for a moment and acknowledge all of that.
Thank you.
Um, I also happen to feel that you're a great representative and a great communicator of our service.
Thank
Yeah, you're eloquent in your ability to be able to explain what you're doing and why, right? Which is something that they drill in our heads
you.
in OT school, right? Why are you doing what you're doing? What is the functional,
There we go.
consequence of that, or what would be the functional outcome of
Yeah.
that? And you did that all throughout, our interview, and I appreciate that a lot because again, for our listeners, especially those who may just be getting into the profession, this is how it's done. This is how we are heard, right? It's through this type of clarity and it's through this type of communication. So thank you, Elle, for sharing that with us. Let's switch gears a little bit. And,
Sure.
how do I know you talked a lot about continuing education and informing yourself, taking extra courses. Um, do you have any advice for any of our listeners as far as, I guess, skills that they can, improve upon, trainings that they can engage in, ways in which you stay on top of the work that you do?
Sure. Absolutely. We know that there's a million and one certifications out there, right? So we can
Yes.
be spending money just for the sake of spending money if we wanted to. But because of the expense that comes with CEUs and trainings, I really tell individuals first identify what it is that you want to do and which training and certification is really going to build upon your skill set. So even though I talked about just basic, lactation and breastfeeding education, I knew that I need to go further if I want to become an IBCLC and do a little bit more training to support mothers even further. So I paid for that course, right?
Mhm.
So identify what it is, what area that you want to practice in, and then find those trainings that align with what it is that you want to do. And also think about those trainings that will set you apart from those who may be traditionally filling those roles, or even just from other OTs, right?
Mm-hmm.
What do you bring to that process? So when people talk to me, like I said, about being in mental health, they're like, we've heard, we don't always think about OTs and mental health. And then when I get into maternal mental health, I said just that little extra line, but yeah, I can also do that childhood development piece though. I can do that screening, because guess what? If, especially our women who are in the justice systems, they have considered to be high risk pregnancies because of drug use and abuse,
Mm-hmm.
and also higher incident cases of STIs and other comorbidities. And so research indicates that moms already have of NICU babies already have a higher stress rate, and that is an indicator of developing some type of postpartum mood and anxiety disorder. And so I thought about, I need to make sure that I'm educating my mom on what development looks like, right?
Yes.
And bringing that piece. So if there is a delay and I'm working and I'm following that mom, I am educating the mom on how to use the ages and stages to chart their child's progress and development, we've now empowered that mom to be that early intervention referral if he or she sees like, it says about this time they should be doing this, and I, kind of monitor it. I haven't seen any changes. And then they themselves can make the referral to early intervention services. So that is how, I chose my CEUs and trainings, like what is going to give me that extra leg up as an occupational therapist, how it's going to support not only me professionally, but what I can provide to my families, and how is that setting me apart.
Yes.
So choose wisely.
Yes, because they are pricey. And it
They are.
sounds like our basic training in childhood development and pediatrics is also something that you lean on a
Yes,
lot.
absolutely. Absolutely. And, just really talking to the families about that floor time, and engaging in play and helping them to understand like children learn and develop through play. Because from my own personal experience, I can speak from anyone, and just observing, I've just noticed that as parents, we've, become less silly and playful and on the floor with our kids. So it's just helping parents to just kind of understand how valuable that aspect is for their child's development. And then it also just allows the parents to let loose and not take themselves so serious as well.
Yes.
So I lean in very heavily on our training in pediatrics. So
Well, thanks for sharing some of that. I think some of our listeners who are interested in moving into this type of work would probably want to know, what can they do extra? How can they get started? Right. Is that a question that you want to touch upon a
sure.
little bit more? Like how would one get started in this area?
Yes. I tell people, don't wait until somebody invent it. If it's in you, go ahead and start it. Like I started writing this down when I was a student. I didn't know any other clinicians who was practicing in maternal mental health. Not that there wasn't any out there, I just didn't know any.
Mm-hmm.
Sometimes when you're in a group, I think there may have been one other classmate of mine, but she was at our sister campus. Sometimes you can feel isolated, and you can sometimes question, like, is this work that I am supposed to be doing?
Mm-hmm.
But if it's in you, like if it's a passion that's in you, go ahead and start developing that as a student.
Yes.
Look into things that you or certification trainings you can acquire without being an OT. So for instance, like the lactation and breastfeeding support, you can go become a certified licensed I'm sorry, a certified lactation counselor. You can
Mm-hmm.
get that. That doesn't require you to have
An
an
OT
OT
license.
degree.
Mm-hmm.
Yeah. So look into those things that you can do right now as a student, and that's affordable
Mm-hmm.
for you to do. And go ahead and start developing your skill right now. Look for free trainings, look for free webinars, because just because they're free doesn't mean that they're not giving you valuable information that you can build upon. So PSI offers a free webinar on maternal mental health, and that's where I got my start and my interest
Yes.
from in terms of what next certification I want to take. And so they have a certification in perinatal mental health, so I'll be sitting for that exam as well. So yeah, go ahead, start now if it's in you. you'd be surprised what little notes here and there that you write down just by having thoughts and how those develop over time. And then before you know it, as you say, you've created a program or you've
Yes.
worked out all the logistics. You've had time to do that as a student, but even for those who are clinicians, again, write it down. If you get the feeling, go ahead and write it down. Because as one of my professors says, that wherever there are people, there will always be a need for occupational therapists. So there's never a situation where I feel like occupational therapists, occupational therapy assistant, occupational therapy professionals are not needed. You just, as you have to say, you have to find your niche and be comfortable with articulating why you are a valued member and you belong in this space.
I agree with that 1000%. And, that goes back to your amazing skill of identifying needs, right? And it all starts with that, because once you've found that need, you just analyze the population, you get to know them, and you offer your service, right? Or you try out your service.
Yes.
And then it's a game of trial and error from there, right? Depending on the larger situation. So thank you so much for sharing some of that with us. Are there any myths or misconceptions that you'd like to call out about working in maternal mental health, or even in lactation specialties or breastfeeding specialties?
I don't think there's any myths associated with it in terms of when it comes to occupational therapists. But I just think that there is a underutilization and awareness of what skills that we bring. And when I am talking, especially with mental health professionals, the one thing that normally gets my foot in the door when I explain to them, I was like, generally when your clients come to you, they're not necessarily talking about the symptoms, right?
Mm-hmm.
They are talking about what did they notice was impacted. So there's always an occupation that was impacted, right?
Yes.
I realized I can't do this anymore. My focus changed and I noticed it's impacting this. And so I have encouraged them. I was like, whenever they have expressed that something has impacted, you should definitely think about bringing an occupational therapist in there. I said, because we're able to break down what those skills are needed in order for them to do it. We have those assessment tools. It isn't just cognition, right? What subset skills of cognition is impacted? Is it the ability to initiate, sequence, plan, organize, continue, terminate? So those are all of those base skills that we're able to bring so we can develop a plan so that we can progress that person in therapy who may have been in therapy for a while and it may seem as if they're not making progress. And so I encourage my mental health colleagues, I was like, bring an OT in because we can definitely get down to those true specific identified skills that's really impacting it. And so that's sort of been like my foot into that space when I'm talking with mental health professionals, and then just also letting them know, like, we are not mental health professionals in the way that you're identified in your training. I am the first, even when working with my moms, although I may be the first person that they open up to, that they share their experience with, I tell my moms I am not a replacement. I am a support member of your support team, of your care management team. However, I think it would be beneficial if you get connected to behavioral health services. So sometimes I could be that initial link to them getting the behavioral health services from a licensed clinical social worker, professional counselor, psychologist, psychiatrist. So first and foremost, I respect the lane of my mental health professional colleagues and let them know that that is not a lane that I am getting in. That is not a lane that I am trained in, but I am trained in the skills that supports a person's ability to be able to participate in activities satisfactorily. And when we all have high self-efficacy about how we do things, that impacts our mental health. So it's not always going to be organic based, right? It's not going to always be because there's some type of imbalance hormonally going on. Sometimes it is our ability to participate satisfactorily in the things that we want to do, need to do, or expected to do. And so my role is just to identify what those skills are that's being impacted and putting those resources and interventions in place so we can bridge that gap as that person continues to build their skill in that area.
Yes. beautifully put. The OT lens, right? Using your OT lens and through the use of our superpower
Yes,
activity analysis,
yes, I
we're
love it.
able to come up with a treatment
Able.
plan. Yes. Or a care plan, whatever kind of plan, or a moving forward plan, whatever is empowering for that individual, right? Because I think
Mhm.
these terms also matter a lot.
Absolutely. And that's what I want to encourage people out there. Don't be afraid to use our terms. I think sometimes we forget that when we're out in practice and just seeing, even when I'm writing my assessment and just working with students, and they're coming up with their assessment as to why the person's here. And I have to remind them, pull out your OTPF until it becomes ingrained in you. Pour your OTPF out, reference it because it outlies those skills, the
Yes.
motor skills, the processing skills, and start using our terminology
Mm-hmm.
when you're out there communicating with individuals. And then I also wanted to share when you were asking, like, what can people do to get in the work?
Yes. How to get started.
Don't always think about getting an income off of it. Like, we all want to get paid, don't get me wrong.
Yes.
But sometimes when you are in an emerging practice, sometimes you need to give your services pro bono, right? Because organizations will, especially community-based organizations, like they want to partner with as many other community partners that are out there. And if you're willing to
Mm-hmm.
offer your services for free, sometimes they don't even need to hear what it is that you want to do. The fact that you want to offer some free and they're able to add an additional service to what they're already providing, that will sometimes get your foot in the door. And once you're in the door, then people will have no other choice but to sit up and take notice. So don't be afraid to offer your services for free, and you calculate that for you. Like with this transition to housing, I have offered 12 hours per month of my time. So if my referrals increase and I got 13 moms, I only got 12 hours I'm giving. We can work out some
Mm-hmm.
other type of plan, but don't be afraid to offer your services pro bono, because again, you're still gaining experience
Yes.
as an occupational therapist, and you're refining your skill in that space without necessarily having the pressure on you, because if people are paying you, they're also going to be expecting a certain
Yes.
outcome and quality of service from you. You should always give quality service, but yes, just don't be afraid to either offer your services pro bono or create some type of bartering system. But it may not always be sitting around you being able to get some type of fee for service
Yes.
initially when you start.
Yes.
Yeah.
I think that that's my superpower too, is bringing myself somewhere and just kind of talking about it and then making it happen. And I'm in full agreement that things take a little time, right? The important thing is really showing your value. And for me personally, it's being able to offer my skills as a resource to under-resourced groups,
Yeah.
right? To folks who otherwise would not even understand what we do. So I feel personally really gratified just having been able to do that and continuing to do that, right? And, our service is so amazing.
Yes.
They can't say no. I say that with full confidence.
Yes, absolutely. Absolutely.
So this has been such an amazing, insightful, informative. I learned so much. When you said earlier about, underutilization of services and, how even in this world of maternal health, right? There's maternal mental health, there's lactation and breastfeeding and 500 other probably little sub pieces that I don't even know about. Even those two I just knew very little about, and you broke it down for us today. You really helped us see the connection between those problem areas and how it can really benefit these populations and why. So thank you for sharing your wisdom and your amazing work. Can you let our listeners know how can we follow you? Is it okay for us to reach out if we have any
Sure.
questions?
Sure. I will be in the process of revamping my website because when I launched it, again, I wasn't doing
Half of the stuff that you're
all of the
doing.
things that I am doing, but you can still just get a sneak peek at occupational transitions. That is with the S on the end.com. My email address is Elle, that's LLE at occupationaltransitions.com. I am on Instagram, and I am at the sewing_OT. So that's sort of like a hodgepodge. So you can get to know who I am. You might see some OT based stuff, breastfeeding stuff, my workout stuff. But I want people to get to know me outside of occupational therapy, and just see, like I said, I'm just a regular smegular degular girl from
Southern
the west
Belle.
side of Birmingham, Alabama. But hopefully you take away as well that I am very passionate about the work that I do. Very passionate about supporting, again, mothers, infants, families, birthing persons. I am just really passionate about birth work and supporting that in any way possible, working with underserved populations. Like I said, I didn't think that I would be working with women in the justice system, but I am absolutely enjoying the work. And lastly, my mothers who have chosen to breastfeed as a form of early infant feeding who have a spinal cord injury. So that is my next rabbit hole that I am
Well, we look forward to hearing about that on another episode.
Yes.
That sounds like some more fascinating work.
Yes.
Well, thank you again for sharing your passions with us, sharing your path towards your passions, and just really sharing your motivations for the work that you do. That it is so inspiring, and I'm excited for our listeners to hear this episode. And again, very much appreciate the uncommon work that you do. Love to have you back again next time, Elle. Thank you.
Thank you. And thank you for your work as well, for helping to spread the word, not only about, the uncommon practices, but also just sharing with all listeners, because I'm quite sure that there are individuals who are not OTs tapping into this podcast who is hearing about the amazing work that you're doing. So thank you for helping to spread the word.
And that wraps up another inspiring episode of the Uncommon OT series. Connect with me at www.transitionsot.com. And don't forget to sign up to be part of the Transitions OT community. By doing so, you'll receive my latest compiled list of uncommon OT practice settings, the latest news on mentoring offerings, uncommon OT live events, non-traditional OT resources, and more. You may also follow me on my social media pages on Instagram and LinkedIn. And if you love this episode, head on over to Spotify, Stitcher, Apple, and Google Podcasts to follow, rate, and leave a review. I also ask you to consider pledging your support to my Passion Podcast project by being a patron on Patreon. It is very much appreciated. Sending big OT love. Thank you so much for listening. Until next time.